So this video is on Chapter 17, Segment 1, Learning and Memory. Learning is a process of acquiring new and relatively enduring information, behavior patterns, or abilities, characterized by modifications of behavior as a result of practice, study, or experience. Memory is the ability to retain information based on the mental process of learning or encoding, retention across some interval of time, and retrieval or reactivation of the memory. The specific information that is stored in the brain as well. There are several kinds of learning and memory. We started talking about a patient named HM who had no new long-term memories. He had a form of amnesia, which is a severe impairment of memory that usually occurs after an accident or injury. The most common type that people think about is retrograde amnesia, which is difficulty in retrieving memories formed before the onset of amnesia. This can happen many times after an accident. People will forget things that happened a few hours, days, or even years before the event. Patient HM specifically is a person who had damage to the medial temporal lobe structures and was unable to encode new declarative memories upon his death. After his death, we learned his name was Henry Molaison, and he had something called anterograde amnesia. Anterograde amnesia is the inability to form new memories beginning with the onset of the disorder. He had an intact short-term memory, but no long-term memory. This displays that they are two distinct things from one another. Henry had a surgery that removed his amygdala and most of his hippocampus and the surrounding cortex from both temporal lobes to help treat his seizures, but this caused memory deficits that seemed to be caused by this loss. Other patients with similar damage but less damage to the amygdala did not have comparable memory deficits, but bilaterally lesioning the hippocampus of mice did not cause this type of memory damage either. Henry was tested using mirror tracing tasks. When he was tested on repeated days, he did significantly better each day despite not remembering having done the task. People with damage similar to Henry's exhibit difficulty reproducing or recognizing pictures and spatial designs that are not recalled verbally to them, as well as them having a difficulty with specific kinds of content of verbal material, but they're able to learn some kinds of information from verbal material. This kind of comes down to a very important distinction in the two general categories of memory. The first is declarative memory, which is a memory that can be stated or described. This includes facts and information acquired through learning or tasks of memory requests for specific information that has been previously learned, such as a work or a list. The second is non-declarative memory, which is a memory that is shown by performance rather than by conscious recollection. This is memory about perceptual or motor procedures, performance rather than conscious recollection. These are things that you can learn by doing, and they're often nonverbal. So the next section is medial temporal lobe structures are crucial for declarative memories. This can be shown in the delayed non-matching to sample task, which is a test which, on each trial, the participant must select the stimuli that they had not seen previously. It's kind of an object recognition memory test where the animals must go to the object that was not associated with the reward previously. Monkeys with severe damage to the medial temporal lobe have great difficulty with this task. The selective removal of certain brain structures have revealed that the amygdala was not crucial for the performance on declarative memory. The removal of the hippocampus significantly impaired performance tests, though, and it became worse when paired with lesions to the nearby entorhinal impaired hippocampal cortex. And again, even worse with more lesions to the perirhinal cortex. Humans show severe impairment with damage to both the hippocampus and the medial temporal lobe. One formulation of declarative memory states that two processes are involved. The first is recollection of the item in specific context in which it was presented, and the second is a sense of familiarity with the features of the recalled items. The experimental evidence suggests that the two processes are served by differing components of the medial temporal lobe system. Perirhinal cortex is thought to be responsible for the sense of familiarity in memory, and the hippocampus responsible for recollection. Processing of contextual aspects of memory appear to be dependent on the parahippocampal cortex, as the hippocampus acts at the final stage of convergence for adjacent regions of cortex, resulting in the storage of declarative memory. People with specific hippocampal damage appear to have difficulty with recollection and familiarity-based aspects of memory, and people with surgical lesions that are on the perirhinal cortex but not the hippocampus experience impaired familiarity despite preserved memory recollection. Damage to the medial diencephalon can cause amnesia. This is patient NA, who is a person that was unable to encode new declarative memories because of damage to the dorsal thalamus and mammillary bodies. He had profound anterograde amnesia, primarily for verbal materials. He had damaged several components of the diencephalon, such as the thalamus and hypothalamus, that have connections to the hippocampus, dorsomedial thalamus, and the mammillary bodies, and he had notable damage to the mammillothalamic tract. The patient showed normal short-term memory, but impaired declarative memory formation. So the medial temporal region, which is what Henry had, and the midline diencephalic region must be part of a larger memory system. People with damage to the fornix also have difficulty forming new declarative memories. A disorder that mimics this is Korsakoff syndrome, which is a memory disorder related to a thiamine deficiency that is generally associated with chronic alcoholism. It was discovered by a Russian neurologist named Sergei Korsakov, and people with this disease often don't realize that something is wrong with them, and they just generally confabulate. Confabulating is to fill in the gap in memory with a falsification, which often occurs in Korsakoff syndrome. Temporal lobe structures, including the hippocampus, are typically normal in people with Korsakoff's, but they have shrunken, diseased mammillary bodies and some damage to the dorsal medial thalamus. The mammillary bodies have served as a processing system, connecting the medial temporal lobe to the thalamus via the mammillothalamic tract, and then to the cortical sites. Damage to the basal frontal cortex is also found in people with Korsakoff's, which may account for the denial and confabulation. The main cause for Korsakoff's is a lack of the vitamin thiamine. Treating with thiamine after the illness can prevent further damage, but it cannot repair the damage that was already done. The brain circuits, including the hippocampus, the mammillary bodies, the dorsal medial thalamus, and are crucial for the formation of new memories. But declarative memories formed before the injury are not stored in these structures. The cortex is essential for patients' long-term storage of memories. This is now patient Casey, who is a person who sustained damage to the cortex that rendered him unable to form or retrieve new episodic memories, especially autobiographical memories. Upon his death, we learned his name was Kent Cochran. He could not remember any personal memories from his past, but his general knowledge remained intact. He could play a good game of chess, but couldn't remember who taught him or where he learned. Episodic memory is memory of a particular incident or a particular time and place. When you recall a specific episode in your life or relate it to an event of a particular time or place, this is episodic memory. A semantic memory is generalized memory. For instance, it's knowing the meaning of a word without knowing where or when you learned it. Brain scans revealed extensive damage to the cerebral cortex or severe shrinkage to the hippocampus and nearby hippocampal cortex. Bilateral damage probably accounts for the anterograde declarative amnesia, but not for the loss of his entire autobiographical history. His loss of his autobiographical history may be a consequence of the extensive damage to his frontal and parietal lobes. There are a few individuals with incredible episodic memory and can remember events down to what they've had for breakfast on a specific morning years before. These people were found to have larger temporal lobes, including larger parahippocampal gyri. Different forms of non-declarative memory involve different brain regions. Specific functions depend on different forms of non-declarative memory. Declarative memory is used to store factual knowledge of ourselves and the world that we use in conversation and our innermost thoughts. Non-declarative memory shapes our abilities and responses to the world around us in ways that are difficult to express. A skill memory is learning to perform a task that requires motor coordination. Mirror tracing tests, riding a bike, or learning to juggle. There are three categories: sensoromotor skills, which is mirror tracing; perceptual skills, which is learning to read mirror reverse text; and cognitive skills, which is puzzles like Towers of Hanoi. A neuroimaging of healthy people revealed that the basal ganglia, the cerebellum, and the motor cortex are important for sensory motor skills. Learning specific sequences of finger movements requires the selective activation of the motor cortex and basal ganglia, with the cerebellum possibly providing error correction during learning. Priming. Priming is a phenomenon by which an association is formed between two stimuli or between a stimuli and a response. This includes both classical and operant conditioning. An example is if a person is shown the word stamp in a last group of words, and then later asked to complete the word STA, he or she is more likely to complete the word as stamp rather than anything else. People with amnesia display priming even if they don't remember having seen a word earlier. Priming is not impaired by damage to the basal ganglia then. In fMRI, perceptual priming has been related to reduced activity in the bilateral occipitotemporal cortex, presumably because priming makes the task easier. Conceptual priming was associated with the reduced activity of the left frontal cortex, and although primarily associated with declarative memory, evidence is showing that components of the medial temporal lobe system, notably the perirenal cortex and the hippocampus, can be involved in forms of non-declarative memory as well.